This is Mayor Chris Bollwage. We have not filmed in our city since early March due to the COVID-19 pandemic. So we're attempting to do our city through Zoom, phone calls, and Zoom messaging. So a few things from our city. First, on Tuesday, December 1st at 7 o'clock, the Elizabeth Avenue Partnership will host their annual tree lighting ceremony. However, due to the current health pandemic, this year it will be virtual. So join us and other residents on Facebook Live and the Elizabeth Avenue Partnership, the market page, as we mark the beginning of the holiday season from the safety of our own homes. And for more information, you can call 908-965-0660. If you need any information concerning any events going on in the city of Elizabeth, which there are very, very few public events, you can call our public information office at 908-820-4124. So what we're attempting to do by Zoom, as you know, over the last couple of months, I have produced Facebook messages, I have produced Instagram and Twitter messages, and all social media. Now we're going to put this on cable television and hopefully reach more viewers. And one of the ways we're doing that today is we're going to have an interview through Zoom with the City Health Officer, Mr. Mark Colicchio, who's been putting in an awful lot of hours, understanding all of the governor's executive orders, the rules and regulations, and how best we can keep our safety of the citizens in our community. So Mark, welcome to the show.
Thank you, Mayor. How are you today?
Pretty good. And yourself?
I'm doing okay. Plugging along.
So Mark is located in another room here in City Hall. And Mark, first of all, you've been here a few years, so why don't you tell our viewers a little bit about yourself?
Sure. I'm actually born and raised in Elizabeth. And I remember meeting you, Mayor, when I was a kid through the North Elizabeth Little League. Where I played. In fact, I could remember winning an award for taking a cab to a baseball game. I remember that fondly. But I started my career in the city of Elizabeth in 1989 as an air pollution inspector. I went back to school to get my registered environmental health inspector's license, back then called sanitary inspector. I then worked as a sanitary inspector for the city before leaving to go to Englewood. And then from Englewood, I went to the city of Newark as a chief inspector in the Division of Lead Poisoning. And then I came back to Elizabeth as a senior REHS, became the assistant health officer, went to go to Morristown to pursue a health officer's position, where I learned a great deal. I learned a great deal on communicable disease and areas that I did not work in when I was the assistant health officer here. So with all of that, I went to the state, went to Plainfield, and now I'm back. I'm back as the health officer since December of 2014 in my home state.
Mark, believe it or not, I remember that award you got because you're the only kid who wanted to play so badly you actually got up, your parents couldn't give you a ride, so you took a cab to the game.
That's correct. I'll never forget that.
Yeah, that was I was like, who takes a cab at your age to the game? And you did. You figured you're going to get there?
My mother was actually very creative. She said, why don't you take a cab? And you knew my
did.
Parents, so you'd believe that.
And you did. So Mark, we've read an awful lot about it. Everyone understands it. But from your perch, what is the novel coronavirus?
Sure. Coronaviruses, you hear that term all the time. They're very common. All right? You mostly see them in the fall and winter. And when you catch the common cold, you catch the flu. Those are types of coronaviruses. Now, the reason why this is called novel is because it's a new virus. All right? A new virus that I believe originated in China back at the end of 2019. And the fact that it's new and is constantly changing, we don't have immunity to it. And novel is just a fancy way of saying new.
So Mark, the virus affects the city of Elizabeth like it's affecting every other area in the country. And as you know, life changed here in the city of Elizabeth on March 16th when shutdowns and lockdowns occurred. We had our first reported case in New Jersey on March 1st. I believe our first reported case in Elizabeth was sometime around March 18th or 20th, if I remember correctly. So tell us about how is it affecting the city of Elizabeth, not only now, but why don't we start back in March and April and then go through the summer on the what's happened here in our city?
Sure. Back in March, you know what? There was a lot of fear going around, a lot of fear of this new virus. If you ever saw the movie Contagion or Pandemic, people were assuming that, you know what, if you touched anything, all right, that you would get this virus and it wouldn't be good. So we were monitoring this. And you know what, when we first started talking about this, one of the first things we did was we made presentations. I mean, working along with the hospital, with the school board, we've conducted many presentations throughout the city. I mean, with not only council people's community groups, but all city employees got a 30-minute presentation on the virus, what to do. And the main thing that I was stressing in these presentations is that this virus changes. It's constantly changing. And I mean, it could be changing as you and I are talking now. I mean, so there was just like a lot of fear. And I also, back in March, just being in constant contact with Trinitas Hospital, their Department of Infection Control and their emergency rooms have been absolutely great. We've been staying in constant contact. Now, going back even further than that, do you remember when the president was issuing travel restrictions? All right, travel restrictions to China. And we have a CDC quarantine station at Newark Liberty Airport. So I was constantly in contact with them because Terminal A is located within the city of Elizabeth and we're right next to the city of Newark. So I constantly was monitoring flights, asking the CDC what was going on and how it was affecting us. And then I can remember we had a very close call at the hospital where, you know, at the hospital wanted someone tested. And at that point in time, the state was really not doing much in the area of testing. And it took the city, I mean, it took myself in conjunction with Trinitas Regional Medical Center 2 hours to convince the state to let us test this person. And it happened to be on the Sunday. And I physically drove this new virus, all right, well packed, from Elizabeth to Trenton to drop it off at the lab to make sure that it was analyzed first thing Monday morning. And you know what? Thank God. You know what? We came back negative. I mean, and as through March, as the mayor was saying, we were getting our first cases. And ever since then, I was reporting numbers as you see on the mayor's messages, numbers of cases every day, where we do the number of new cases, that number of open cases, number of closed cases, total cases, and the number of deaths. So as this was going on, cases just became more and more. I mean, we were getting averages, maybe we were getting 1 to 2, then it was up to 5, and then it just became, you know, we were getting over 100 a day. And I believe that we were up to at least 150 a day at one point. Don't you remember, Mayor?
Well, back in March and April we were, and then we fell off to about 5 a day, and now we're up to almost 200 a day in this month. I also remember the presentations you spoke about, where you and I held them in city council chambers. We held them at the Public Works Division, where you went to police headquarters and fire headquarters and dealt with all the shifts back in March. We literally spent hours educating all of the city employees on what to expect with this virus and how the virus spreads. So if you can talk a few minutes now about how the virus actually spreads. We know more now than we did back in March.
Sure. The virus spreads through person-to-person contact via droplet nuclei. All right, and pretty much what happens is when you're in close contact, and what I mean by close contact, and that has changed. Oh, that has changed over time too. For the longest time, it used to be 10 consecutive minutes. All right, now it's 15 minutes over a 24-hour period. And that's what I mean, how this virus changes, and those guidelines changed overnight. So, I mean, if once a person is in close contact with someone that's infected, all right, the virus is spread through the air and through what we call droplets. Those droplets now are inhaled into the lungs, all right, causing the virus to build up. Now, there's a few different types of spreads that we want to talk about. All right, the first one is symptomatic, a person with symptoms, all right, that's spreading the virus to someone else. Then we have something called asymptomatic spread. It means that the carrier, the person harboring the virus, all right, does not show any signs and symptoms and can be spreading it to another person. All right, to me, that's the most dangerous. That's the most dangerous because the person who has the virus does not even know he or she is spreading it. And then we have something called communal spread. All right, and at first, there was no evidence that it was being spread just throughout the community. And now all of a sudden, there's large communal spread. I mean, and communal spread simply means people who have been infected with the virus in a given area, including some that are not sure if they became infected, they seem to be spreading it easily within the community. That's where I believe they came up with the term RT. When you hear the governor's message, the RT is the rate of transmission. And that's simply how fast this virus can be transmitted to another person. Now, let's say if the RT is a 1.5, that means that 100 people have the potential to infect 150 people. All right, so that's just an example of what RT means.
So how do we slow the spread of virus? In the beginning, they didn't recommend masks. Now they're recommending masks. Some people, if you're in a lot of contact with 10 or 20 or 30 people around, they recommend double masks. So what are the precautions residents should take? Tell us a little bit about why masks are so important.
Sure, masks are important because they serve as a barrier between the disease and spreading the disease to other humans. All right, that's pretty much the purpose of a mask. The mask is a protective measure. It not only protects the person, it protects me from the public when people wear masks, and it protects the public from me when I wear a mask. So it's pretty much between a barrier between the person and the virus spreading.
And the residents can take precautions. We've heard them. Wear a mask, wash your hands, stay at least 6 feet apart. The reason for that is because the aerosols can't travel that far in normal conversation. Is that correct?
Correct. They were able to measure that the aerosols can travel they could travel up to 6 feet, which is why when they defined social distancing, they used 6 feet. That's correct.
However, if you cough or sneeze or laugh or speak loudly, then those aerosols can travel further.
Correct. That's correct.
Yep. The early signs and symptoms, can you go through them again, what the early symptoms are of COVID-19?
Absolutely. Signs and symptoms are fever, but fever greater than 100.4 degrees or above, which is why when you go into places, first thing they do is they take your temperature. All right. Persistent continuous cough, shortness of breath, along with other symptoms. All right. Now, it includes chills, shivering, muscle pains, all right, which are flu-like symptoms. Headaches are in there now, sore throat, loss of taste and smell, diarrhea, stuffy or runny nose, and nausea. All of those now could be considered symptoms of COVID-19.
And it's interesting when you talked about how the virus changes, stuffy and runny noses and headaches were not part of the early symptoms.
No, that's correct. I mean, what used to be part of the early symptoms was fever, cough, and shortness of breath. Then all of a sudden we expanded to loss of taste. People were when our contact tracers were going out, they were noticing that some of the symptoms had commonalities such as loss of taste and smell. So that was interesting. And then all of a sudden the muscle pain, the headaches, the sore throat, And it just continued over a period of time. You start getting more and more common symptoms. And what's scary is a lot of these symptoms are very similar to allergies. They're very similar to cold and flu. So, I mean, it makes people even become more nervous. And it's one of the reasons why we're encouraging a lot of testing. We're encouraging people to get tested because you may think it's allergies, but it very well could be something else. So the best way to find out is to get tested.
And if you're tested and you're positive and you're not symptomatic, what's the most important thing you can do?
The most important thing you can do is stay home, isolate. All right, they say isolate for 10 days. I personally, you know what, I like to go a little longer. I know I tell people to isolate up to 14 days. 4 extra days isn't going to hurt, and you have that extra assurance.
Mark, we're going to take a break, run a couple of commercials, and come back and talk more. And we'll start with the contact tracing we're doing in the city of Elizabeth.
Okay.
Please stay with us after these messages, back with more on Our City. This is Mayor Chris Bollwage. Welcome back to Our City, where I'm joined by our health officer, Mark Colicchio, for an in-depth examination of COVID-19, not only the rules and regulations put out by the CDC and the governor's executive orders, but also what we're doing here in the city of Elizabeth in trying to keep our residents throughout our community safe. Mark, one of the things we talked about before the break, you mentioned contact tracing. Currently, we're up around over 1,200 contact tracing that we're doing. Tell us what the people in City Hall are doing when it comes to the contact tracing and the open cases we have.
Sure. Before I even go into contact tracing, I want to go into the process of a disease investigation because that's where it all starts. All right. Once a person is tested positive, either the lab or the hospital, they enter them into a state system called the CDRSS, the Communicable Disease Reporting System. From there, it's assigned an investigator and it goes on to a contact tracing tool called ComCare. So what happens is that the investigator assigned to the case starts interviewing the patient. And one of the questions that they asked is, where have you been over the past few days? Where have you been? Who have you been in close contact with? And by close contact, those that you were within 6 feet in for 15 minutes or longer over the course of 24 hours. All right, once those contacts are identified, then contact tracers get the case, and contact tracers now start interviewing the contacts about what they've been doing, about where they've been, whether there have been any commonalities. And pretty much the contacts that are directly connected to the patient, they have to quarantine for 14 days. You notice when I use the word isolation for the patient, all right, and that's confusing. You have isolation and quarantine. When a person is sick and infected with the disease, the patient, as we call them, the patient goes into isolation, and their direct contacts, all right, those that they have been in contact with within 6 feet for 15 or more minutes over a 24-hour period have to quarantine. And that's separating those folks that have been exposed from the rest of society through the course of the incubation period, which is the time that you're exposed to when signs and symptoms occur. And the incubation period for this particular disease ranges anywhere from 2 to 14 days, which is the reason for the 14 days. Our contact tracers, I mean, they've been doing a great job. Like you said, over 1,000 open cases, all right, that our contact tracers are tracing. I mean, it's a lot of work. It takes a lot of time. They're working almost 24 hours a day doing this. And there are times too that you can get one individual case, have several contacts. So, I mean, so that makes the job sometimes even more difficult. We seem to be getting cases like contact people that are living together, people that are congregating. And then you tend to see, like, if there's any other commonalities. Have they been to a restaurant? Have they been to different businesses? And we trace things that way.
And by doing that, we can also assess whether there needs to be a direction or a plan to close or limit any institutions. And as of now, we're not really seeing a cluster like in one economic sector.
Correct. I mean, it seems to be spread all throughout. It seems to be spread all throughout the city. Like, there doesn't seem to be like any specific areas of town that have more disease than others. It seems to be like throughout the entire city. And of course, our neighboring cities, the city of Newark, we also neighbor Linden, we also neighbor Roselle and Roselle Park. So we're looking at cases all in those direct areas too, because it's like we're all affected. Like, it's not just Elizabeth, it's Elizabeth and the surrounding areas.
So Mark, you talked about contact tracing, and we talked about healthcare, and we talked about quarantine and isolation. When should someone seek emergency care if they're being quarantined or isolated regarding this virus?
Oh, that's an excellent question. Well, the cutoff point for the fever is 100.4. And I think when you see that fever starting to elevate, go to 101, 102, or even 103, all right, that's the time to start, seeking emergency care. When you're starting to have shortness of breath, all right, and it's progressing and breathing's becoming more and more difficult, that's when I think you should be going to the hospital, not even like an urgent care. Because, I mean, an urgent care will treat the fever, the urgent care will take a look, they'll determine whether or not you should go to an emergency room. But I always advise people, if they're feeling sicker, just go to the emergency room, especially when you're having more difficulty breathing.
Mark, who's at highest risk for developing COVID-19?
The people that are at highest risk are the elderly, are those with underlying medical conditions, such as heart disease, your high blood pressure, your diabetes, your lung disease, people that smoke. And I mean, there's a whole list of them. There's a whole number of factors that make people vulnerable.
So Mark, how can, one of the things I always talk about is personal responsibility. What can residents do in order to stop the spike or slow down or bend the curve and all those words we've been using for months?
Sure, residents are the biggest help. All right, the first thing that you want to do is, if you're sick, stay home. All right, even if you think you have allergies or a cold, stay home. All right, don't go into work. Don't go commingling within the community if you're sick. Secondly, all right, avoid gatherings, avoid large gatherings, because that's known for spread. The more people that you have closely congregated, the more likely it is that someone has the disease and is spreading it. Wear a mask. All right, a mask, remember, that serves as a barrier, all right, between the virus and not only you getting it, but you spreading it to others. And of course, social distancing. All right, you've heard that term a lot. And social distancing is simply staying 6 or more feet away from someone. Because as we explained before, just with normal conversation, your aerosols can spray up to 6 feet. So taking these steps is very important, and it's the best thing that you can do, all right, to slow or help curb the spread of this disease.
Mark, what are some of the misconceptions of the virus? What are some people, the trickery? What are some of those?
Some of those is, you know what, you hear things on TV. I mean, you hear things, for example, you heard the president saying one day too, ultraviolet light, all right, inhaling or injecting yourselves with alcohol or with bleach. That's not true. I mean, that's not true at all. It, I mean, things like that, I think, give people the wrong information. And I think the best way to get the correct information, you know what? Speak to your doctor or speak to your local health department. And I think that's the best thing that you can do. All right. And rumors, there's another myth going out there. All right, rumors, anything that's shipped overseas, specifically from China, will make you sick. That's not true. That's not true at all. And people that say masks do not protect against COVID-19, that's also not true. Masks right now are your best protection because, like I said, it serves that barrier between the virus and the public.
So, Mark, some people want to know, can you test negative and then positive or negative, depending on the number of tests you have? And when should you test after a positive test, or should you not? Just explain that process.
Sure. Whenever somebody is exposed or they're under quarantine, we always tell them to wait at least 6 days before you get a test, because by then, all right, it's building up enough in the body, all right, where you can start. You could just about start having the virus replicate inside your body, all right? But it doesn't mean, so let's suppose if you come back negative after the 6th day, you still have to do the 14 days because remember that incubation period goes up to 14 days. It's 2 to 14 days. So you could also even get the virus up to the 14th day. So sometimes too, you may want to get tested on the 6th day, you may want to get tested on the 13th day or on the 14th day because that's important. And you can test negative one day and positive the next because all the test shows you is where you are at the given moment. So yes, it's possible that I can take a test today and become negative, and I could take a test 2 days from now and become positive. And you know what? Because it's what's going on with you at this given date and time.
So in Elizabeth now, we didn't have it then, but the county has been terrific with testing at Kane University. You can also get tested at Elizabeth High School. And we've had other locations, the Peterstown Community Center. We're working on the Exlaven Center. And as we develop more rapid tests, there'll be more opportunities for testing in our city.
That's correct. And as the health officer and every other public health professional, we encourage everyone to get tested, especially because there's a lot of asymptomatic disease out there. And you know what? The more people that get tested, the more disease we find. And the more disease we find makes it easier to contain it. So a lot of times you will hear these high numbers, but it also means that there's more testing involved. And you know what? It's not a bad thing. I mean, numbers seem high, but it means that we're catching more disease and we're able to do a better job containing it.
And
I would say keep up the testing.
And we're also able to separate asymptomatic people.
That's correct. We're also to isolate people that are asymptomatic. All right. And like I said before in the beginning of the program, to me, they're the most dangerous because they don't know they're spreading the disease.
Mark, I want to thank you for taking the time out of your schedule and all of the phone calls and meetings that you have to do in order to share some time with the viewers of Elizabeth on the benefits and of masks and the benefits of testing in order to help stop the spread and slow down the curve of this virus. Thank you very much.
My pleasure.
See you soon, Mark. For Mark Colicchio, who's doing a great job as the health officer here in the city of Elizabeth during this pandemic, I'm Chris Bollwage. We'll see you next week again on another edition of Our City.